Hello, everyone. It's great to see
Hiya.
you. Hi. I'm sorry I appeared late. I didn't sign up for this meeting for some silly reason, so I had to figure out how to get in. So these sessions are being brought to you through a new reverse Rett project called Rett Connect, which has been funded by the Pears Foundation. I'm Rachel. I'm the executive director of Reverse Rett, and I have a daughter and a stepdaughter with Rett Syndrome. So what we normally do in these sessions is we typically invite a specialist to come along and speak for 30 minutes, and then they'll answer questions for half an hour afterwards. And that's been really good, but we're actually going to do something different today for the first time. So we've had some really good professional speakers, but at Reverse Vet, we strongly believe that parents are the true experts in our midst. No one's become more specialist in our particular field of dealing with Rett syndrome in this particular child than we have. And the thing that we know with Rett syndrome is that we are consistently delivered new symptoms all the time, new skills to learn, new specialties to get to grips with. And as time passes, because of the variability in symptoms across different people with Rett syndrome, some people develop more skills more quickly than others and more experience. So today we are holding our first parent expert panel on scoliosis in Rett syndrome. And with us today, we have Joanna Tomlin, Helen Simmons, and Andy Stevenson. The discussion today is obviously going to focus on the personal experience of the parents on the panel, reflecting on what did and didn't work for their children. So it's not intended as medical advice. If you have questions for the team, you can pop them into the chat box during the presentation, or you can just raise your hand either virtually or the old-fashioned way. Please, could you keep yourself on mute until you do want to speak so that we don't have a lot of feedback on the audio. And we will be recording today, won't we, Beth? Yeah, so we'll be recording the session. So if you don't want to be seen, turn your camera off. Joe, Helen and Andy, it's a pleasure to have you here today. I'm going to ask you to introduce yourselves briefly, where you live, tell us the name of your daughter and her age, the age she is now and the age she was when she had the surgery. We will start with Joe, move to Helen, and then to Andy. Joe, over to you.
Hello, good morning, everybody. My name's Joe. I'm mum to Keisha, who is 33 now. She had her scoliosis fusion when she was 14 back in 2004. So, and we live in London.
Hi, I'm Helen Simmons. My daughter is Lauren. She's 14 and she had her scoliosis surgery 3 years ago, almost exactly 3 years ago, in 2018, and she was 11 at the time. We live in Wokingham, Berkshire.
And I'm Andy. Hi, everyone. My daughter's Beth. She's 21. I also have a stepdaughter who's 25, Amber. She had her surgery in 2012 when she was 12 years old, and we live in Manchester.
Thank you. So thinking about the pre-surgery time, early scoliosis. So obviously I should preface this by saying I think scoliosis is something that all of us dread and are looking for from an early age, but it would be interesting to hear from you guys when the spine, the curve in the spine was first noticed. So Joe, if we start with you again, for Keisha, when was that? Was it, and what was suggested at the time?
Well, it was quite strange, really. Keisha was 6 when it was first noticed that she had a kyphosis rather than a scoliosis. So they didn't suggest anything at the time. And then by the time she got to 8, the scoliosis had started as well. So they advised on, the bracing, wearing this big spinal brace to try and slow it down, which we did. We did use it, but not often because I didn't really like it and she didn't like it, and it restrained her mobility. So we took the decision to just out with the brace and just let things progress naturally and see what happened. So yeah, That was our history of the scoliosis and how it started, and the age about 6.
And Helen, was it similar? Was it similar for you?
Yeah, it was about 5 or 6, and we noticed that there was a slight curve. Our daughter has always really struggled with maintaining weight. She's very slight, and even now, and at the time, it was very evident just by looking at her that something was starting. I think at the time she was about 5 or 6, and she measured 17 degrees. So the scoliosis is measured by degrees, and we were told at our local hospital that they keep them until they're 25 degrees. Anything over that, they then refer them on to an orthopaedic specialist. So for us, it was in Oxford at the Nuffield Orthopaedic Centre. So for a couple of years, she was monitored locally, and we used a lycra suit initially to try and slow things down. That was hellish, to be honest. Putting that on and getting it off again every day was hideous. So we were actually quite relieved to then move on to bracing, because it was a bit more straightforward for us. And that was done as soon as we moved into the specialist orthopaedic team at Nuffield. But then from then on, she was monitored 6 monthly, and it was fairly slow progression to begin with, but it did then escalate very quickly, despite bracing.
And did Beth have a brace? What happened with you?
Just probably a similar story to Joanna and Helen. It started off quite slowly, and there was a little bit of a curve when she was around 6 or 7. And then it sort of stayed quite consistent up to about 10. And then it was around, thinking back, it was around 35 degrees, I think. And they suggested a brace, which was, she was then measured for and everything else. And they told us there was no evidence that it helped. But we were very, I was divorced, so I was in a different position, but I had Beth 2 or 3 nights a week. And we were both very rigid with putting it on, and she had it on all the time. It was horrible. She hated it. It was summer, so she got very hot. And when she ate, and she ate a lot, that's probably her favorite activity. If you didn't loosen the straps at the back, her stomach expanded and she was in agony. And you know what it's like when you've got 100 things going on. Sometimes you start feeding and you forget. And you could see her face sort of change, and she started to look in pain, and then you'd go, oh God, I forgot. And then you released it. And we also, around a similar time, maybe a bit younger, my dad bought her a little Shetland pony, because I'd read that horse riding can help with scoliosis. So she went on that about 3 or 4 times a week, as much as possible. And then after we'd had the brace around 6 months, we went back to the hospital, and it was around the time that she was going through puberty, which was quite early, about 11, and a curve had gone to about 95 degrees in like 6 months. It just accelerated so quickly. It was terrifying. And we were almost left then with no decision to make about surgery. There was no real option. Looking back, the one thing I would do differently is not have the brace. It was a complete waste of time. It didn't make any difference whatsoever. And I've never met anyone who's used a brace, or family who's used a brace on a child, who has said that it's improved things. So there's still no evidence, as far as I know, that they help. So it's
possible, though. I'm wondering is it possible, and I don't know the answer to this, that somehow it makes it more comfortable for them when they're sitting, like they somehow feel more supported?
Well, it didn't with Beth. She hated it. She hated every minute it was on, and we were just like so scared that we just left it on, whether she liked it or not. She did get used to it a little bit more, but looking back, those 6 months were just so uncomfortable for her, and it turned out to be a waste of time. So I would think if you're in that position, I would think very hard about using a brace. and whether you want to go through that or put her through that.
I would agree with Andy, actually, that I thought that the brace was a complete waste of time as well. It didn't actually sew anything down, and it just caused extra pain, really, and discomfort. And also, I think it stopped them enjoying other things, it stopped Keisha enjoying other things. And she was a good ferocious eater as well at the time. So, yeah, I think that personally, I think the brace is a waste of time.
For us, it was a bit different. We went through a series of different braces. There were a couple that were really quite uncomfortable and she didn't tolerate particularly well. But when we kind of found the one that was best for her, it was much more malleable than the others. Some of them are so rigid that they just cannot move an inch. But we found one that had more flexibility in it, and in doing that, it was just as you just said, Rachel. Actually, her position was so awful by kind of 18 months before the surgery that without the brace on, in her sitting position, she would be really uncomfortable and we would have to reposition her. So she was actually better with it on and more supported, and certainly she could then use things like a standing frame. Without the brace, she couldn't do that. So for us, I wouldn't say she found it particularly comfortable, and like Andy said, in the summer it's horrible because they have to need another layer between them and the brace, so they have a vest on underneath it. So there's layers, and in the height of summer that must be horrible. But for us, it certainly helped her in terms of position. Didn't slow anything down, but in terms of just managing day to day and keeping her upright enough that she could digest food, actually, because Lauren's curve, she actually had a double curve, so one at the top and one going the opposite direction at the bottom of her spine, and they were impacting her stomach. So we had to keep her as upright as possible in order for her to get food in, go down and get through her bowel. So it was quite important for us to use it.
I just wonder if, because Joanna was obviously 2004 or 5?
4.
And we were 2012. I just wonder if there's more options available now, because I don't remember ever having any option at the time.
We didn't have an option either.
This is what we want to try, and it was a Boston brace. It was just the most rigid thing ever.
Yeah,
maybe they've got better braces now.
Yeah, we found some that some of them clipped on the side, which made it really awkward in a wheelchair. So they were almost like a clamshell that opened up, but the fixings were on the side. Because Lauren had a gastrostomy port, we also had to have a hole put in it, which can change the integrity of the brace. So again, they have to look at that and make sure that it's the right kind of brace in order to keep the strengthening there, because when you cut a big hole in it, suddenly it becomes almost pointless because it just lets everything go. And like you, Andy, we had to make sure that it was something that could be released easily, because our daughter has always suffered with gastrostomy issues and bloating, and still to this day does. And so that's something she has to have access to make sure that we could undo it easily, for feeding and things.
I was just going to say, relative close to what Andy said, because Louise has commented that Georgia, her daughter's spinal consultant, said not to bother with bracing as they make no difference, and he advocated use of a standing frame as an upright position, being more helpful. I wonder if, I don't know if we know the answer to this, but I wonder if over time the advice about back bracing and, as you say, Andy, the options available are changing, and that maybe there's a move away from bracing. I don't know if that would be true or not, but it sounds like there's been a shift even in the three of yours experience. Sorry, go on.
All I wanted to say was I feel like this is quite unusual because with the NHS, typically they don't provide things that don't work, but everybody seems quite clear on the fact that bracing is not effective. So that's why I asked Helen the question about if it's a positioning thing to try and ameliorate the symptoms, and enable other life activities like eating. Then that must be the justification for spending money, Louise.
So wheelchair services, when they saw Georgia, it was through them that they then said about having a back brace. So she had a brace mold done and everything else. She wasn't under the spinal consultant at this point. It was then when we went to see him, he said, don't bother with it. It'll make no difference. If it's going to curve, it will curve. So we were like, oh, right, okay, because again, like the others have said, it was just so cumbersome to get on. She never seemed comfortable in it. I mean, thankfully, George's is still very slight, but we were trying to get in early and stop it. And he said, upright positioning is your best option. Standing frame as much as possible will have more benefit than a back brace. And also, it's almost like different departments don't talk to each other and you get conflicting theories.
You know that.
I think as well, things like there are other not alternatives, but things that should be in place at home, such as postural seating and obviously the wheelchair and a sleep system in the bed. Because I think for us, it was the bed that has been the biggest culprit for Lauren. She was a side sleeper and always has been, actually. And her curve has really exacerbated by the fact that she never got on with the sleep system very well. It was always really tricky to manage with her. And obviously because gravity is pushing them down all the time, it's just putting force on that. And I think so the sleep system is something I would advise anyone to get in place as quickly as possible, and is really quite key in holding them in a good position throughout the night, as well as the postural seating and potentially bracing. But we couldn't use things like the standing frame without a brace. And we're in a bit of a unique situation in that Lauren had the spinal surgery in 2018, but she's now on the waiting list for it again. And the reason being that because she was quite little and very slight, she had a lot of growing to do at 11 when the surgery was done. But they used growing rods as opposed to a static fusion where it's fused to the spine. She is fused at the pelvis with growing rods to allow her growth. And what those growing rods have done is their job in allowing her to grow, but they haven't stopped the scoliosis, and that has come back with a vengeance. So she's now in a worse position post-surgery than she was prior to having the first one done.
Helen, let's go back to the decision to have the surgery in the first place. Okay, so what age was she when you went, actually, this is going to have to happen for sure? 10?
For us, it was probably, actually, it was a bit different again, because Lauren has always suffered with really awful reflux. So when we were told in the September 2018, so it would have been September 2017, we were told she had to have spinal surgery. And at that point, I think she was about 75 degrees, something like that. We then had to have a fundoplication done to try and get the reflux under control before having the spinal surgery. So she had to go in the December following that September to have the fundoplication done to stop the reflux, in order to then be able to lay on her back post spinal surgery, which then happened in the May the following year. So I think, as Andy said, earlier, there wasn't really ever a decision for us. Once we knew that she was being monitored for 6 monthly, every one of those appointments we would go to with dread, and then come out of it thinking, phew, we got away with it for another 6 months. But we knew ultimately at one point we would go to that clinic and he would say, right, she needs the surgery, and that's when it happened.
But sometimes
it's almost like a rock and a hard place. You don't really have an option, because of the impact it has when they get that bad on all of their other organs and their posture and their breathing and their eating and their digestion. It just affects everything.
Sometimes the surgeons will say someone's too young and they might need to do a bit more growing. And I have seen people get really severe curves before they're operated on. So how was the decision made for you for Lauren to go ahead and while she was still so small? Was it just at the point of you had to do it?
Yeah, because in the months between, we saw him in the September and she was 75 degrees. When the day of surgery, she was 106 degrees. So even in that short space of time, it had deteriorated so much and we had everything in place. But it was just the impact on the rest of her life. But for us, it was the decision of having that spinal fusion or having the growing rods, which at the time, there are two different kinds of growing rods. One is the Medjet rods, which they're magnetic, and they basically post-surgery, then as they grow, the rods are stretched using a magnet system, and allows growth. But that the surgeon felt for Lauren, because she was such an anxious child, that she just wouldn't cope with that kind of post-surgery activity, really. So for us, it was straightforward growing rods, which just allow her growth. And if she ever got to the end of them, then we would have to look at a further surgery. But at no point did anyone say to us, the scoliosis is likely to push back even worse than before, because had it done that, we would never have gone that route. Because we're now faced with a situation where she's got potentially 2 spinal surgeries, one to take everything out, because absolutely everything, even the fusion in her pelvis, has to come out, and then one to put a fusion on her spine in. So she's got a huge ordeal ahead of her again, which we never anticipated would be. So I think my advice to anyone that has a little one going into surgery, really think about that and ask those questions. I mean, I don't know what Joe and Andy think, but my experience of our spinal consultant is that he's very different to deal with than any other consultant that we see. It's like getting blood out of a stone trying to talk to him. They do seem to have a bit of a reputation for that. And so it was very difficult to kind of ask the questions without knowing what we were meant to ask, really. You kind of want to be guided by them. But yeah, I would definitely say if they're having growing rods, certainly, then there are lots of questions you need to ask beforehand.
Okay, what are those questions?
I would look at obviously the Medjet rods, if that's an option, and just the basic question of what is the chance of the scoliosis coming back, so that you can be more informed about whether you make that decision to go with the fusion straight away. So they have one operation and they never have it again. Obviously, the downside to that is that they will never grow beyond their size at that time in their body. Their legs will still grow, but the torso won't. So, that's where that decision has to be made. For us, she was just so tiny, it seemed the good option at the time, and that's how it was sold to us, for want of a better word.
So just so I understand then, I need to clarify this because I don't really know enough about scoliosis because it hasn't impacted my own daughter. And I've shied away from it for that reason. So what you're saying is if you do have the fixed spinal fusion when they're small, they won't grow anymore. Don't grow anymore.
Not their body, because it's fixed to their spine, so the growth is going to be extremely limited. But their legs can grow, so you know they're not.
But why? I don't mean to be stupid, but why is it bad that they're not going to grow in their body? Because I'm quite a small person. Something like some people are.
I think just in terms of their development. So for us, it was just because, you know, she hadn't gone into puberty. We hadn't gone through any of that. And so.
Would you still have puberty even though your spine was fixed? Presumably, yeah, but you'd be small.
Yes. Yeah, but it's just, for us, it was just sold as being a better option for her, given that there could be growth. And I think, you know, as a parent who knew nothing about scoliosis surgery, we were guided by that.
Yeah, no, I mean, obviously, we all have to make the rock and hard place decisions at the time with the information that we have, and there's a lot of things that you don't know until after. But I suppose the only reason I was asking you these questions is for the benefit of people who are in that similar kind of position and thinking about how they can like make an educated and informed decision about what they're doing.
Yeah.
So Andy and Joanna, Helen has just said that, well, she made a comment about the spinal surgeons. You know, you might want to address that, but also just thinking about, you know, when you found out that Beth and Keisha had to have the surgery, did you feel there was any window? Because I think the hard thing is when you're faced with this situation, sometimes people seem to put it across that it's a choice. And actually, when you look at the literature, it's very clear that people need to have the surgery because the long-term outcomes are not good if you don't have it. But as Helen's experience has shown, there's this window where you're still growing, and it's best thing is if they get the scoliosis after they've you know hit puberty and they don't have a lot more growing to do. You can bang in the fusion and then that's it. So what happened with you, Joe? Did you because Keisha was quite young, wasn't she, when you first realized? So
yeah, but she didn't actually have the surgery until she was 14, and for exactly that reason her surgeon said to me that it's best to let her go through puberty. After she started her first period, a year after, that's when women generally stop growing in height anyway. Otherwise, you run the risk, apparently, of growing out of the fusion. So you'd have to redo it. So on that basis, we waited until Keisha started her period when she was 13. And she was, I mean, I couldn't tell you what the degree of the curve was because I didn't know. But she couldn't sit up straight anymore, and she had huge problems with her gut and breathing, and you can imagine. So we waited anyway, alongside with the surgeon's approval, really, till she was 14, because it was at that time that we believed she'd done all her height growing that she was going to do. So the scoliosis fusion that she had was fixed, and she's never had to have anything else done to it since. And we're talking about over 20 years ago that she had that surgery. She had it in 2004. So, well, yeah, 20 years ago. So, yeah, it's stood the test of time, put it that way.
So that's kind of interesting, Joe. So in a way, you had to make the decision. For you, the hard decision was almost not to have it and to wait, because presumably you were watching her deteriorate, and the impact of just having to go, let's hold our nerve almost. Let's just
absolutely. To have a better outcome following the surgery. I mean, we all know that, you know, it's major surgery. So you want the best possible outcome that you can have. And the surgeon, who was, he, you know, they're very matter of fact and quite abrupt, and, you know, will only talk for as long as they want to talk. But he actually gave us really good advice and said to us the best outcome would be to wait a year after her first period starts. Then her growth will no doubt be finished. So therefore the scoliosis fusion would be more successful. And he was right. I can say, you know, that she's straight now. She can sit up. She can't sit up unaided. and we've not had to go back and have any repairs done or anything else. Nothing as dramatic as Helen and her poor daughter. So yeah, I'm glad actually on reflection that we did wait. Although the year that we waited was awful, absolutely awful, and awful for Keisha. She was so uncomfortable and in so much pain, and it impacted on everything. She couldn't eat anymore, and that's when she ended up having a tube. And yeah, so it was difficult. But if you're going to have major surgery like that, I think personally, it's probably best to wait until all the growing's done if you can. It worked for us.
Beth, with you, Andy, Beth was, I remember because I'd just met you at the time, she was so curved around at 11 that you didn't have any more time to wait, right? So you had it before puberty. So you didn't wait, but she didn't have the growing rods, did she? She had the
No, she had the same as Keisha. The surgeons are just unbelievable. They just you've got to, if you're going to go through that, you've got to brace yourself for how they are. The first person that we saw who explained the operation described it as a controlled car crash, which he said in front of Beth, who then screamed, because they don't think that, you know, people with Rett syndrome have any, you know, they don't know what's going on. They're not. It was definitely a horrible moment that's sort of burnt into my brain that I'll never forget. But fortunately, he didn't do the surgery, so that was a little bit more reassuring. It was a different one. But yeah, she got it. It was cancelled the first time. It was due in around October or November, and then she ended up having it in the March the following year. And about a month before she was due to have it the first time, she lost the ability to stand and walk. She could never walk unaided. She always needed help, but she was so twisted by then that she couldn't basically stand up. So again, there just wasn't a decision to make, and it's strange. My personal opinion, and it is only an opinion, if this is going to happen, it's going to happen, no matter what. Because I see a lot of families now who go for the checkup and they have the spine done, and there's been no deterioration, and they aren't doing anything in particular to stop that. So they're not halting it in any way. They're just living their lives, and then they go 6 months later or whenever, and there's no deterioration, and it's always a cause of celebration. So I think if it's going to happen, it's going to happen. And if it's not going to happen and you get away with it, it's not going to happen. But like I've said 100 times, you know, people with Rett syndrome are so unique and different. And even Beth and Amber are totally different and have different issues and have had different issues in the past. So if something's going to happen, it's going to happen. And I don't think there's a lot you can do.
No, I mean, listening to Helen and the rapidity of that decline, you said even between the surgery date and the kind of booking it in date, there was this massive decline. So obviously, Helen, you didn't really have the same window of choice. You're going to reach a point where you can't postpone anymore. You can't wait until puberty hits or make that choice. But I mean, Andy, as you say, you've said a lot of times, I've heard you say lots of times, if this is going to happen, it will happen. And but it seems like certain children just are more have a propensity towards it. And I wonder if is there any study or any evidence to show what is it in certain girls that means that some girls will deteriorate at that speed, even when you have everything in place, where Helen's got the right seating, the right postural stuff, and some girls decline. Well, some girls it never happens, and some girls it's very, very, very gradual. Do we know anything? This is harsh to put to the three of you because we're not medics, but I'm just wondering if there is any evidence out there or even any patterns that we've seen with the families that we know.
I'm just guessing it's down to the mutation, but I'm not sure. Do you know, Rach?
There are papers that show that specific mutations are more likely to have severe scoliosis than others. But to me, the main thing is if they walk, if they weight bear, they're less likely to need scoliosis surgery. If they continue to walk and weight bear, the difficulty there is, again, it's something that people can take, credit for, where credit is probably not totally due, is it? Because some children with Rett syndrome have never walked, and it's not because people haven't tried hard enough, they're just not going to walk. And some people lose that, and it isn't, again, down to things people could have done, because I think for the most part, most of us are trying our best most of the time. Some people just don't, they lose it. So
I'd agree with that, because Beth had everything. She had a walker, she had a stander, at school, at home. In the summer holidays, he lent it to me and I brought it home. So even though we were divorced, living in different boroughs, we both had the same equipment the majority of the time. So there was nothing there that you could pinpoint and say, oh, if we'd done this or we'd done that. We did everything. And it was a 6-month window where it just went bang and accelerated faster than, and even the doctors were surprised. So I just don't think there's anything that anyone could have done regarding Beth.
I agree with Andy. Keisha was the same, really. She did used to stand and she did walk independently. She did lose that anyway. And then she'd walk with us supporting her and on a walking frame. And then she went down to walking on her knees. But I don't think anything could have stopped it. I think it was just something that was going to happen, and it happened. Luckily, she had a longer window of opportunity that we could keep her from having the fusion until she'd had her period and lasted that 12 months. But I think it's something that's going to happen, it's going to happen. And I don't think there's anything that anyone can do about it. It's just, if you've got that propensity to have scoliosis in your child, then there's nothing you can do to stop it. So I don't think anyone should beat themselves up about it. Just have to make the decision for what's best for them, really.
We're all good at guilt though, aren't we, Joanna?
Yeah, definitely. Everything's always on reflection, isn't it? I just think
sign them all up for horse riding immediately. Almost the first thing we did after diagnosis was we read somewhere that horse riding would be good for the spine and keep the spine straight. So we signed her up, and she did horse riding once a week for 6 years, until she was too big to get on the horse anymore. And coincidentally, we don't actually have any sign of scoliosis yet, but it's easy to then ascribe that to whatever it is you happen to have been doing. But we also don't have postural seating or a sleep system, so it sounds like a bit luck of the draw. I think you've all of you have touched on this a little bit, but and for Joe and Andy particularly, it'll be looking back. But in terms of life kind of after the surgery and how that impacted your daughter's lives and also the whole family's life, do you have reflections on that you can share?
I think we made the right decision. Don't get me wrong, the first 3 years after the surgery was not so great, but on the whole, it was the best thing that we could have done for Keisha, because she was able to sit up straight. Positioning her was easier. So feeding her via a tube was easier. She wasn't so bent over. I was trying to struggle for the tube, when someone's so bent over is quite difficult. So yeah, I think we made the right decision. A difficult one. It's never ever easy, but it was the best for Keisha. It's difficult after.
So when you say those, 3 years sounds like quite a daunting length of time to say things were. What was difficult in those 3 years?
Keisha's wound got infected at the bottom, and she ended up with Pseudomonas in her lungs, which is an opportunistic superbug, and it was very, very difficult. She nearly died, and we had to fight and struggle to get her on the right treatment plan. And it took Keisha 3 years to get back to her normal baseline. So she was back to her normal, happy, smiley self, which she isn't now, obviously, but she was then. So it was hard, but it was because of the infection, essentially. I imagine if it had just been the scoliosis and everything had been fine post-operatively, then it would have taken 6 to 12 months, I think, to get good healing in that. So, yeah.
Okay, so, that is a really rough 3 years, but on reflection now, you can say it was still worth it.
yeah, definitely. Then I was saying, oh, I wish I'd never had it done. You know, this is terrible. What have I done? You know, I've given her more problems, blah, blah, blah. But having gone through that and gone through the infection and being able to successfully treat that too, I'm glad now when I look back that her quality of life is so much better. It really is, you know. Just being able to sit up in itself is amazing. And she went horse riding too with her school. She used to go to this little special needs school in Brixton, and they used to take her to Chelsea Barracks, you know, and this very nice group of ladies did it through a charity. So she used to go horse riding once a week, but it didn't help. So I think it's just a mutation personally. Yeah.
You can't, I mean, from my point of view, you could never regret having it done, because I don't think she'd be alive if she hadn't had it done.
Yeah.
So there wasn't, like I keep saying, there was no decision to make. But she's had a bad time. She had a bad time as well, just like Joanna and Keisha. She had she was released from hospital about 3 weeks after having the surgery. And that's very nice. I remember I went and got her into the car, and then her mum took her home. But I remember just having a sense of dread, because I could sense something wasn't right. And then that very first night she was home, when she woke up in the middle of the night, and a wound was leaking, and she was rushed back in an ambulance, and she had an infection as well. So they had to open the wound up, and flush it. And the surgeon said at the time, we've had to do this with some people 10 or 11 times, where they sew them back up and the infection's still there, and they have to go back in and do it again and again and again. Fortunately, she only had to have it done that once, but she was very, very ill. She was in intensive care for about 6 days, and was asleep for most of that time. And then she was in there for probably 4 weeks. So when I see people who have gone in, had it done and come out, and there's been quite a lot on Facebook that I've seen where it's been really quite smooth and there's been no issues. That wasn't our experience, but that doesn't mean to say that people are going to have my experience and Beth's experience. After one of the first things that they saw after the surgery, when they x-rayed her, was that her hip had come out of its socket, because they've straightened her up. It's popped out because she has shallow sockets anyway. It's an issue with her. And initially, the hip surgeon who didn't do the back said she was going to have to live with it forever. And I questioned why, and he just said, she's got Rett Syndrome, she won't walk anyway. And I said, well, she used to walk. And he went, oh, I didn't know they could walk. So that showed you the lack of knowledge about the condition at that time. So we weren't happy about that. So she had to wait 18 months with this dislocated hip, because if they treated the hip, she may get infected in the spine again, and then they would have to take out the whole thing and start from scratch. So they said we had to wait 18 months, and then after 18 months, they could do the hip operation, and the metal would have been in there long enough that they wouldn't have to do the whole thing again. So she had 18 months where she was just in a lot of pain, obviously. And when we got her home after she'd had the infection, the drugs that she was on made her constantly have diarrhea, which was just I can still remember some of the times I had. Went on for hours. It was just constant changing her.
I'm not laughing. I'm laughing. This is knowing laughter. Like we were together at that point, and you know, yes. But please tell me, Helen, that your modern experience of the surgery was, although you've had this difficult time afterwards, and you're obviously going on to having another operation or two. What was the actual time that you had the surgery like? Was it more efficient? Did you go in, stay in for a week and come out?
Yeah, I mean, ours was actually a really positive experience, and you know, despite his social credibility, our surgeon did a great job. in the actual surgery, which is where you need them to be really good at their job. And Lauren's wound it healed really well, really quickly. It amazed me how mobile. I was terrified that she was going to be this fragile bundle coming back into ICU from recovery, and she was for a couple of days. But as soon as we were moved from ICU and out onto the ward, we were in a side room. It was very quiet. Lauren is prone to seizures. Despite the fundoplication, we were still having reflux issues, and reflux would be one of her triggers for seizures. So I was terrified about her having a seizure post-surgery, because the last thing you need is one of those ripping through, but it happened. She had a big tonic-clonic seizure about 4 days post-surgery, but nothing budged, and nothing, she had no infections, no wounds. We were in hospital for 10 days, but actually, really and truthfully, we were there for other reasons, not her back. I think, had we not had other problems, the one thing for her is that during general anaesthetic, one of the horrible side effects is that Lauren stops sleeping. So when she comes round from surgery, it's happened, she's had 3 major surgeries, and all 3 times, she then doesn't sleep for days, and she literally didn't sleep for 8 days post-surgery, not even a nap. She had to be sedated in the end, but she also came out of scoliosis surgery having this really bizarre effect on her gut that then caused her to have horrendous bloating and distension, bowel distension. And she honestly looked like she was pregnant, like at full term. Her stomach was so distended, and the reason, we never really got behind the reason for that, but I remember asking on one of the family rep forums after that whether anyone else had experienced that during scoliosis surgery, and apparently there were about 3 parents came back and said yes, exactly the same thing. So I think it's something that is fairly common, but we ended up, had she not had that, we would have been out within 5 days. And I mean, we literally had the physio and OT from the spinal team knocking on the door in ICU wanting to get her out of bed within 24 hours of having the surgery, which again really surprised me, because I just thought she would break. But they got her up, they got her hoisted, they got her in a chair. And then over the sort of 3 months following post-surgery, she recovered really well. Initially, she needed a little bit more pain relief. We only came out of hospital, and in fact in hospital, once she was off morphine in ICU, she was just on paracetamol and ibuprofen. And that's all we had when we came home. There was nothing special. And she had that. She did have to have a week of warm just to help her once we got home. But other than that, her recovery was really good. And the X-ray that was done about 3 days post-surgery, in it, as well as sort of straightening out the spine, her whole rib cage had twisted. By the time she had surgery, her ribs were almost kind of where they side to side. I mean, they were in a really awful position. And for the first time in years, we saw her neck. And she was straight, you know, in her chair. Her ribs were where they should have been, her rib cage, and not round the back. She had this big lump in her back, which was her ribs. And, you know, they were all in the right position, and she just looked great, actually. So it was really, you know, about 6 to 8 months later that we just started to see a little kink in her waist again, which is when we suspected something wasn't quite right and that the scoliosis was coming back. But prior to that, it was a really positive thing, and it just helped everything, really.
Yeah, Beth was a foot taller when she came out. It was weird.
Oh yeah, they grow inches overnight, literally 3 or 4 inches.
This sounds, you know, it sounds from the three of you, the kind of journeys that, which is encouraging for anyone who's watching with a younger child and thinking this might be on the cards in the future, that actually, you know, the progress in terms of the surgery itself and the aftercare. I mean, Joe, after Keisha's surgery, did you get physio and OT? Did you have any support?
Not really, no, but you're talking a long time ago now, so things were very different to how they are now. So we had the wheelchair services come up to mould her a new chair, because obviously the chair that she'd had previously to the operation was when she'd had scoliosis, so it obviously didn't fit her anymore. And I found that their pain management was absolutely useless, because we discovered that she was obviously sensitive to morphine, so couldn't have morphine, because anytime they give her morphine, she went to respiratory failure. So she ended up on paracetamol, which didn't really cut it in the first week following the surgery. So the support was quite non-existent, really. We didn't have any physio at home, because we used to get that at school, but she couldn't go to school because she was so ill and in so much pain. And then she got the infection. So yeah, but it's probably not reflective of today. I'm hoping that things are so much better. And I've seen as well on Facebook that quite miraculously girls and boys come out, you know, within 5 days. And I think, wow, if only that had been our experience, I wouldn't feel as if it was so traumatic, which it was. I can't lie. It was quite traumatic. It's probably been one of the most traumatic things I've ever been through in my entire life, let alone Keisha. So, yeah, I mean, I'm just hoping that things have improved. We're more modern, the treatment's better, they know more about people with Rett syndrome, that pain management is better, you know, and I think it's probably good to have that discussion if that's the road to go down, you know, but it is a positive thing, and Keisha is alive today because of it. So very much like how Andy said, you know, it's something that it's not really a decision, is it? You have to do it because you know what the outcome is if you don't, essentially. So yeah,
I mean, that's what I was thinking, you know, the contrast between your experience of maybe post-surgery and that support and Helen's is at least encouraging. I mean, it's bad for you that you didn't get that, but it's encouraging for anyone in that situation today. That, and as Andy said, you know, we do see on Facebook lots of families who do go in, come out 5 days later, and there aren't complications. So obviously all three of you have had, unfortunately, experiences where there are complications, but hopefully the surgery itself and the aftercare is much better these days than, you know, than it was for Keisha.
Absolutely.
I would also add to that, the one thing that really helped us, because of Lauren's anxiety, her seizure activity, and obviously the reflux problems that we were having prior to surgery, we really impressed on absolutely anyone that would listen, and got the support of her paediatrician before to write to the surgeon to stress that Lauren needed to have, if possible, a side room in the hospital when she came out of ICU. And that needed to be taken into account because she was fully aware of what was going on. So we used the reverse Rett hospital passport. We just produced it at the time, and I filled that in and took that to the pre-op. And actually it was one of the, there is a huge pre-op process to having spinal surgery. Once the decision's made and you go on the waiting list, you then get sent a date for pre-op. Some hospitals do it all in one day. So, and that was the experience for us. It was 8 hours in Nuffield Hospital, and we had x-rays, photos, we saw the anaesthetist, we saw the surgeon, we saw his doctor team, we saw his the OT, the physio, the planers for the ward, absolutely everybody, and it was incredibly intense. A day that we'll never forget, and actually it was quite hard to come out from that. But other hospitals do it so that they do the pre-op over a series of days. So you go and get your blood tests done, you go and get x-rays done, you might need to go and have a DEXA scan done dependent on, you know, bone density, and you would go to different people, but for us it was all on one day. And so we gave a copy of that passport to the play nurse who was associated with the spinal team. And she then kindly disseminated that to everybody on the team. And on the day of admission for the surgery itself, I walked into the admissions room, and we had asked them that Lauren not be taken there either, because from our past experience of surgeries, they gather all the children that are going in for operations in one room, and all of the doctors and nurses and everybody go in, and they get you to sign the consent forms telling you about all the risks that you're signing your name against. And that's horrific for the children to listen to, because the risks associated with spinal surgery, there's no sugarcoating it, it's huge. And it is not an easy thing to listen to, that that's going to happen, potentially happen to your child. And the last thing they need before going to surgery for that is to hear that as well. So we asked that Lauren wasn't present at that. But when I walked into that room, Lauren's anaesthetist was there with her reverse Rett passport in her hand, reading it. And I couldn't have been happier, because everything that I knew that they needed to know was in that thing. So I can't stress enough how important that document was for us, and would encourage anybody going in for any surgery, actually, not just spinal, to use one of those passports, because the whole team had it. When she went to ICU, it was sitting on the top of the folder. So absolutely everything was in there. It was so important. And they knew everything. And it also stressed the fact that she needed a quiet space post-surgery. And so we did get that side room. And again, I know other people just get put onto the ward where it's busy, it's noisy, there's machines beeping. And this is such a massive surgery for our kids to go through anyway. They need some quiet time, and they need to just be able to gather themselves. You know, they have enough to deal with Rett syndrome, let alone with all of that stuff going on. So I would really stress to kind of get in your pre-op, really use that time to sort of stress what you need for your child, and get your pediatrician on board so they can really compel that to the surgeons and the team involved.
That's really helpful, Helen. I'm conscious of time, and I was actually just going to get to a kind of wrap up of saying, you know, what if there was one piece of advice you would give families now, with the benefit of your experience, what would it be? Helen, you've kind of just given a really valuable piece of advice about the hospital passport, which I think is really useful. Andy and Joe, would you have one piece of advice or reflection that you think, you know, would help families in that situation?
Have a good pain management.
No.
Sorry, Andy.
No, you go.
Pain management, I would say.
Okay.
Have a good discussion about pain management.
Yeah.
I was just going to say the same thing, because when we knew that she was going to have the surgery, we didn't know anyone who'd had it. Because I didn't know you then, Joe. You would have been quite helpful at that point. So I'll have a word with you about that later.
Okay.
So I wrote to Monica Coomrads and just asked her if she had any advice about what we should do. And she said the same thing, pain management. She said, there's a myth that people with Rett syndrome have a high pain threshold. They don't have a high pain threshold. They show pain in a different way to what we would. So the nurses who might, even if they have heard of Rett syndrome, they won't know anything about it. They will try and take her off pain meds as soon as they possibly can. And if Beth's quite stoical, where she'll, you know, if she's in pain, she can sometimes lie there, and they will take that as that she's recovering and she's not in as much pain, and would try and reduce the meds. So it was vital that we sort of insisted that they kept up the med, you know, the pain management regimen that they had her on right at the beginning, longer than she probably, who can say if how long she needed it for, but that was the one piece of advice she gave me. She also sent me a few papers, and there wasn't a lot published at that time, that I gave to the surgeon who was doing it, and he was quite open to reading them and taking some of the advice. I can't exactly remember what they were now, but I might be able to find them in my emails. But not all, as you know, not all doctors and surgeons are interested in hearing somebody else tell them what to do. But this one was, he was really good. So yeah, pain management.
I agree.
That's really interesting.
In preparation for today, I was just jotting some notes down, and I remember there was another Rett family friend of mine that their daughter was having surgery a few months after Lauren had hers, and she emailed me privately and asked, you know, what if there was any advice of practical things to do pre-surgery and post-surgery. And because it was all very fresh in my mind, I'd sent her a whole list of things, like, you know, Lauren had really long hair, so we got her hair cut into a bob a week before the surgery, just because you can't wash the hair for a little while. So, and dealing with, she hates having her hair brushed anyway. So trying to brush her hair when she's just come out of surgery would have been a nightmare, having laid on it for a week. So things like that. And I found it kind of in preparation for today. So I'm quite happy if it would be of any help to draft that up into a bullet point list that maybe you can share on Rett Connect. It's just, they are just very practical things like that, like doing an enema a couple of days or the day before the surgery, having a haircut.
That would be perfect, because those are the exact sorts of things that people can't get from doctor's appointments.
No,
But they're actually the most life, you know, the things that you can really do to make a difference, aren't they?
Yeah, that would be really, if you send that to me, Helen, I'll send it out to everyone who's registered. That would be great. Thank you.
that's fine.
I'm just thinking how strange the brain is, because I was thinking about doing this for the last week or so, and should I prepare and everything else. And I was starting to worry that I'd come on here and not have that much to say, because it was so long ago and it was so traumatic that I couldn't remember details. And sitting here listening to Helen and Joanna and thinking back to that time, it's amazing the things that are coming back to me, like the stuff that Monica sent me. I remembered the pain management, but it was only when I was telling you about that I remembered that she'd sent some papers as well that the surgeon read. So
Yeah, we can make them out.
Thanks for making me revisit this horrific experience.
Yeah, well, you know, I was just going to say, I think it's brave of you all to come and revisit it, but I also think it's brave of the people who've come to listen and anyone who watches this after, because it's not for the faint-hearted, let's face it.
Can I just say, Gail, are you on now? Can you hear me? I know you're probably muted.
Hey Andy, yeah, I can hear you. Can you hear me?
Yeah, can hear you now. I know Kira's got this surgery. Have you got a date or anything yet?
No, we don't. I mean, we're due to go back in the next couple of months. I mean, it's just been, I'll be honest, a little bit overwhelming listening to everybody. It's helped so much, and I'm not going to cry. I'm sat here crying as I'm listening to some of it, because it is just so real for us at the moment. Sorry.
Don't be sorry.
No, listen, it helps. It helps. You, Rach, you know me. I have to have a little meltdown, then I get on with it. But, you know, ultimately, I suppose it's just mind-blowing hearing kind of our story and you guys telling it, and it helps so much knowing we're not the only ones. But similar to yourselves, Kira's has just come on so fast. And I'll be honest, we go back in June or July and answer to your question, Andy, that I think they'll make a decision then, but I think I already know, since we've last saw them, I could see it getting worse. I just can. So I kind of feel a bit like yourselves. I feel like we've got this choice to make, but I'll be honest, I don't think we have a choice. I think I wish we could hang on, and it was interesting listening to all the points about the growth piece and puberty and so on, but For me, it just feels like at the moment there isn't a choice. And we already know that they want to do Kira's hips. She's got a similar situation to one of you. The hips are dislocated, one of them has. So we're kind of seeing both at the same time. They're talking about 6 months in between the surgeries. So yeah, it helps so much. And do you know what? I've been sat here doing a little list as you were talking, because there's so many more points now I'm ready to go and talk to the consultants about when we go back in June or July. And actually daft things like you were talking about the practical stuff. As you said it, the haircut, I know it sounds crazy when we were talking about mega stuff, but I was like, yeah, absolutely, that makes total sense. And it's not till someone says it, do I go, what a brilliant idea. So this has just been really emotional, but really, really helpful. So God, I can't thank you enough. It's been great.
The other thing that we did in preparation for surgery, Gail, was we worked with school quite a lot. Lauren, she's got her own eye gaze device, and I mean, she uses it well at school. She doesn't really use it at all at home, but unless there's something really drastic to say, and she did have something really drastic to say about the spinal surgery, which was utterly heartbreaking, to be honest, to hear her thoughts about it. But the one thing I would say is it's so consuming, all consuming, because every conversation that you have with a professional, with school, with a therapist, it all ends up being geared around this surgery because it impacts every aspect of their lives. And so we really consciously tried to make sure that we weren't having detailed discussions in front of Lauren with anybody about the surgery until such time that she needed to know about it. Because again, when you're dealing with a child who's got high anxiety levels, the last thing they need to hear about is details. And in fact, since going through the experience the first time, we now don't take Lauren to, we take her to get x-rayed, but I always take someone with me. So Lauren never gets to see the spinal consultant unless he needs to physically see her, but he just looks at her and then talks to me anyway. He doesn't actually examine her or anything. But I now don't take her into the appointments, because when he dropped the bombshell on me in December, 23rd of December, just before Christmas, just gone, about the fact that she now needs revision surgery, he dictated a letter in front of me explaining all of the equipment that was needed, including the wire cutters that he was going to be using on her. I mean, that's how utterly unprofessional and awful his bedside manner is. It's just dreadful. And no parent needs to hear that, and no child needs to hear that. But you know, that's the kind of thing. We tried to limit her exposure as much as possible. But school were also really good in providing, once we had told her, they helped by creating a visual storybook. So it had a picture of the hospital, a picture of the ward. We used symbols in it, and they worked with me to create this story to kind of say that she'd be going to this place, going for a big sleep, having the surgery, and it was really useful. And then some of the staff that she sort of really gets on well with at school, they would take her for little one-to-one sessions every now and again, just to talk her through this book and give her an opportunity to communicate with someone else other than me or my husband about it, so that she could express if she was worried about anything with someone else. And equally, they helped me build some really useful pages to go on her eye gaze that are called I Need Something. And they're just very simple commands, so they don't have to build up sentences of words on the eye gaze. It's literally, I need a cuddle, I need Calpol, I need to change position, I need my pad changed, I need something to help me relax, I need my book, whatever it might be. And again, I've got that on her eye gaze, so I'm very happy to copy that file and send it to you if she has an eye gaze on grid that might be a useful template for you to use at school or at home with her pre and post surgery. So it just gives them an instant way of communicating their needs really post surgery. So if that's helpful to anyone, I'm happy to share that as well.
Thank you, Helen. I think that's really helpful. And Gail, I'm glad that although it's been emotional, that you feel it's been helpful to you as well.
Yeah, I think it's just because it's so real for us right now. So I don't sound normally a blubbering mess, but I know you all get it more than most.
No need.
Don't worry, I've seen you a blubbering mess before.
I know you have.
We've all been blubbering messes at many points.
Yeah.
It's absolutely fine. I'm conscious of time. I think we need to wrap up. And I know Rachel will move us on to the other sessions that we've got coming up. So I will just say my own thanks to Helen, Andy and Joe for sharing their experiences today, even though it's not easy. It's not easy stuff to share, but thank you. I think it's been really, really valuable.
You're welcome.
As Beth
And I'd
said,
just like to say thank you as well. Not being a parent of a child with Rett syndrome, but just being a grandmother and not living with my granddaughter Eva. Sometimes I feel quite dislocated from them all, but you've been so amazingly open and revealing about the ups and downs of the surgery, and it may be something that's going to face us in the future, and it's given me a lot of hope that I'll be of some support to my family if and when that happens, because of the knowledge that you've given me. So thank you for your generosity in sharing so much of your own girls' lives. So thank you, Rachel and Joe and Helen and Andy. I really appreciate what you've done, and I've enjoyed participating in the session today. I've found it amazing. Thank you so much.
well, it's brilliant that you've
coming,
been able
Jennifer.
to be here, and I hope you'll join more sessions, because there are some that aren't as heavy as this. This has been a bit of a heavy one that, you know, is a bit more daunting, but it's good to hear the feedback. If you have any feedback, positive or negative, we want to hear it, because it's the only way that we can shape the sessions to be more helpful in the future. And also it helps us to try and get funding for this project. The next bite-sized session will follow the same format on the subject of gastrostomies, not as serious as surgery, but I think a very emotional decision to do enteral feeding, basically. So I think that'll be interesting. That's next Friday, the 14th of May, also at 11 o'clock. A more informal session that we have, which is the family forum, which is next. Is it Wednesday? Yeah. The 12th of May. In the evening at 8 o'clock.
Yeah.
And it's more just to chat. And I think last time we ended up discussing some of the stuff that had happened on Bite Size. So it just is where we have a bit more space for people to share their own experiences. And the information about all these different sessions will be emailed to you later on today. Thank you to Joe, Helen, and Andy for speaking to us and for being so open and honest, even though it's painful to go over it again. And, you know, for Helen in particular, it's not over yet. Thank you to everyone that's here listening and everyone that tunes in afterwards. I hope everyone has a great rest of the day and weekend. We're all gonna close the session now, but if there are people that want to stay behind and have questions or want to share a little bit of what's going on for them, you're very welcome. So
even I just want to say thanks to everyone. I had the moments of a little bit heavy heart when I was listening to the experiences of the parents. I just had tears like Gail, but it's really useful, and it's a bit of worrying as well to think of what's the road ahead of us. It's very informative too. I'm very thankful to the parents, everybody who are there here. I'm just losing my words as well to what to say.
well, Saritha, thank you so much for saying so.
Saritha.
And you know, I think we're all feeling the same thing about, well, I'm not, because I don't have that looming ahead of me in the future. I don't mean I understand to that extent, but well, hopefully anyway. I don't know if it really happens to people once they're adults, does it? This scoliosis thing, once you've kind of cleared adulthood, you've gone through all your growing, you generally can get a bit more of a curve, but you generally have missed the surgery, haven't you? So, but I think we don't shy away from the hard stuff, but at the same time, we don't want to bring everybody down for the rest of the weekend. So hopefully it's been, but the main thing I would say, the main message I've taken away from listening to the experience of these three is that as time progresses, different pieces of it improve, whether it's the bracing or the surgery itself, the recovery time, pain management, then, you know, also I think just as more and more people pioneer it, the girls themselves, the parents, and all of the helpers that are involved in their lives, people learn more and things improve. So hopefully that will be the case moving forward for you, Gail. And if Saritha, if your daughter has to have the surgery and everyone else, it will continue to get better.
Hope so.
And at some point you'll share what you've learned and help the next people. But, you know, hopefully we'll get to a point where less and less of these later interventions are needed, because there's more transformative therapies that make a difference in the lives of people with Rett syndrome earlier. And that's what we're going for. So, all right, have a great day, everyone. Thanks for being here.
Thanks, everyone.
Bye.
Bye.
Bye. Bye.
Great to meet you all. Goodbye.
Thank you.
Bye.
Bye-bye.